Understanding cat eye-watering problems, causes, symptoms, and care. Watery eyes in cats, also known as epiphora, is a common but potentially concerning condition that can affect felines of all ages and breeds. This problem typically presents as clear discharge around one or both eyes, which may cause staining of the fur, crust buildup, squinting, or signs of irritation. While mild cases might be due to environmental irritants or temporary allergies, persistent eye watering can signal underlying medical issues that require attention. Recognizing the possible causes and knowing when to seek veterinary care is essential for ensuring your cat's eye health and overall well-being. There are several reasons why a cat's eyes may water excessively. One of the most common is conjunctivitis, an inflammation of the pink membrane around the eye. This condition may result from a bacterial or viral infection, allergies, or even a foreign body trapped under the eyelid. Conjunctivitis often causes red, swollen eyes along with watery discharge, and sometimes it's contagious to other pets, especially if the cause is viral. Another frequent cause is upper respiratory infections, URIs, which are particularly common in kittens and shelter cats. URIs are similar to the common cold in humans and are often caused by viruses like feline herpesvirus or calicivirus. These infections typically include sneezing, nasal congestion, and eye discharge, and can become chronic if not properly managed. Allergies are also a culprit behind watery eyes. Cats can be sensitive to dust, pollen, smoke, perfumes, or certain cleaning agents, just like humans. When exposed to these allergens, their eyes may become irritated and produce more tears in response. In these cases, watering may occur without other signs of illness, but long-term exposure can lead to more serious inflammation or infections. Foreign bodies, such as a speck of dust, a blade of grass, or even a tiny insect, can irritate the eye and lead to excessive tearing. Cats might paw at the affected eye or keep it half-closed in response to the discomfort. In addition to these causes, anatomical issues can also lead to watery eyes in cats. Brachycephalic breeds, those with flat faces and short noses like Persians, Himalayans, and exotic shorthairs, are particularly prone to eye watering due to the shape of their skulls. Their shallow eye sockets can cause the eyes to bulge slightly, making them more vulnerable to exposure and dryness, which in turn triggers overproduction of tears. In these breeds, eye discharge may be a chronic condition that needs regular maintenance rather than medical treatment. However, excessive tearing in any cat should never be ignored, especially if it's accompanied by other warning signs. Blockage of the tear ducts, known as nasolacrimal duct obstruction, is another condition that can lead to watery eyes. Normally, tears drain through tiny ducts into the nose, but if these ducts become blocked, due to infection, inflammation, or congenital issues, tears can overflow onto the face instead. This is often seen as constant wetness around the eyes, sometimes with brownish staining of the fur. A vet may flush the tear ducts to relieve the blockage or recommend surgical intervention in rare cases. Corneal ulcers, which are painful sores on the surface of the eye, can also cause a watery discharge along with redness, squinting, and sensitivity to light. These are serious and require immediate veterinary care to prevent vision loss. When dealing with a cat's eye watering issue, it's crucial to observe the surrounding symptoms. If the discharge is clear and your cat is otherwise active, eating, and playing normally, it might just be a mild irritant or allergy. Gently wiping the area with a clean, damp cotton pad and monitoring for a few days may be enough. However, if the discharge is thick, yellow or green, or if your cat is squinting, pawing at the eye, showing signs of lethargy, or if the problem persists beyond a couple of days, it's time to visit a vet. Eye problems can escalate quickly in cats, and prompt treatment can make a significant difference. Veterinarians may conduct an eye exam, use fluorescein dye to check for ulcers, test for infections, or recommend allergy testing depending on the case. Treatment often includes eye drops, antibiotic ointments, antiviral medications, or anti-inflammatories. In chronic cases or with congenital issues, long-term management may be necessary. Prevention is also important, keeping your cat's living space clean, avoiding smoke or strong chemicals, and scheduling regular vet checkups can help protect your cat's eyes. In conclusion, while watery eyes in cats might appear minor at first, they can be a sign of a more serious issue. Whether due to infection, allergy, or anatomy, it's important to pay close attention and act quickly when something seems off. With proper care and attention, most cats can recover fully and comfortably, keeping their bright eyes healthy and clear.